Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello viewers, my name is Sheela Krishnaswamy and we are having a discussion on rabies to observe the World Rabies Day on September 28th. And to talk about that and to understand more about rabies, we have two experts with us today. Dr. Kashyap Dakshini, who is an MBBS from Mumbai University. Dr. Kashyap Dakshini is a general physician practicing in Burli, Lower Parel area. He has 26 years of experience with Hinduja, Leelavati, and Holy Family Hospitals and corporates like SBI, Air India, Reliance Industries, ICICI, HDFC, Aditya Birla, and Kotak. Dr. Kashyap is a part of the managing committee, IMA Mumbai, that's the Indian Medical Association Mumbai, and a member of the Indian Association of Occupational Health and General Practitioners Association. Welcome to this discussion, Dr. Kashyap. It's great to have you with us.
Thank you.
The next expert here with us is Dr. Vivek Arora. Dr. Vivek Arora is a qualified vet and has nearly 19 years of experience in independent clinical practice in Delhi. He is a regular columnist and speaker on small animal health issues and zoonotic diseases. With focused and continuous efforts, he wishes to take veterinary diagnosis, treatment, and care to a new level in India. He is popular among pet parents as a compassionate veterinary doctor who is known for promoting the best veterinary diagnosis, treatment, and care. Welcome to you, Dr. Vivek Arora, and so nice of you to join us today for the discussion.
Thank you. Thank you.
Yeah. So let's begin this very special discussion organized by THIP Media, and this is to observe the World Rabies Day. I'm going to move straight to questions, and the first question to you, Dr. Vivek Arora. Dog bites seem to be the most common cause for rabies in India today. How can a person identify and stay away from a rabid dog?
First and foremost, there is, of course, a sort of a conflict cohabitation between animals and humans, as we currently see. Spaces are getting smaller, crammed, vehicular attractions, humans playing, children running around, have actually made a sort of a fear psychosis being developed between animals and humans. And canines or dogs and cats are the two most commonly small animals which come to our contact inadvertently, or sometimes they would just come and bite us. First and foremost is we must, of course, Dr. Kashyap will highlight that further, is that WHO clearly says that in any event of a dog bite, scratch, or the degree of wound break on the skin, there is a protocol of post-bite exposure that has to be followed. B, but the general guidelines are, of course, washing your wound with a hard soap, making sure that you show it to a physician sooner than later. But the most important part as far as observing an animal is concerned are few things. A, have you ever seen that pet cat or dog in your locality before? Is there a history of that dog biting someone else as well, randomly, without provocation? And thirdly, and most importantly, that if the dog can't be observed, please don't take a chance. It's always better that you get into a post-exposure protocol rather than waiting and realizing that there's something wrong.
Dr. Kashyap, this question is to you. Why is rabies considered dangerous?
Rabies is dangerous and life-threatening because almost 99 to 100% of the times it is fatal. Once a person develops rabies, there is no specific treatment available worldwide. After the onset of rabies, the only treatment is supportive care. WHO figures state that India accounts for 20,000 human deaths annually due to rabies out of 59,000 global deaths, that is worldwide. As per the statistics of the National Rabies Control Program, there are close to about 2 crore animal bites annually. Rabies spreads by an animal bite or a lick or an abraded skin, that is skin which is not intact, or mucosa, or scratches. Hence, urgent intervention is of paramount importance as soon as there is an animal bite or a scratch or a lick. The incubation period in man varies between 6 days to 6 months and an average between 30 to 90 days, depending on the amount of virus injected, the site of the bite or a scratch or the lick, and the depth of the wound. Rabies affects the nervous system, and the virus travels from either the skin or the muscle to the peripheral nerves, the spine, and then the brain.
Okay. That's interesting to note. What you said in the beginning is that India sees 20,000, almost 20% of, 50% of the world number of rabid deaths. Why is India so high on the list? Any reason for it?
So, of course, the population density is one of the main reasons. So, number of people living in a smaller area. Hence, people are coexisting, as Dr. Vivek also mentioned, coexisting along with animals. And predominantly, it's the dog bite which accounts for 96 to 97% of all rabies. So, population density and, the geographical area with, high amount of population and very cramped space is the main reason.
Okay, thank you for highlighting that. Dr. Kashyap, again, this question is to you. What are the immediate steps to follow after a person is bitten by a dog?
So the immediate steps that one needs to take is which is called post-exposure prophylaxis. So once a person is bitten or scratched or even licked by a dog, and if that skin is unintact, then the first thing to do is to wash the wound immediately with soap and water. And even if there is any delay, even if it's over the next 1, 2, or 3 days, it's important to keep washing the area which is the wound with soap and water. To use povidone iodine, which is, for example, betadine, and or also use 70% ethanol or alcohol, for example, Dettol, if that's available. It's important not to cover the wound, and it's important not to use any skin irritant. Do not cauterize the wound at all, or do not touch that wound with bare hands. And for those who are immunocompromised, which is for those people who are either HIV positive or cancer patients, or those who are on long-term steroids, the efficacy of the vaccine is low. Hence, it's important for them to be administered rabies immunoglobulin. It's also called anti-rabies serum for passive immunity, because these are ready-made anti-rabies antibodies. Now, the actual schedule of the rabies anti-rabies vaccine is that one should take it immediately as soon as one realizes that there is a bite or a lick or a scratch. That is called day 0. And then thereafter, it is on day 3, day 7, day 14, and day 28. Now, it's important to keep track of the animal as well. So if the animal is alive after day 10, then the last 2 doses of day 14 and day 28 may be skipped. But it's important to vaccinate, and it's also important to know, as Dr. Vivek had put, the history of the dog, if the dog has been biting others in the past as well. So that's very, very important.
Dr. Vivek, what should a pet parent do to control rabies in their pets? I mean, that is, if it is rampant in pets, because normally I think we see rabies in stray dogs. So is it really rampant in pet dogs as well? Or, what does a pet parent do for this?
Any pet parent or any pet owner, or probably somebody who works for dogs is listening to us right now, can just remember 3 things. Rabies can only happen through bite or saliva of an infected dog. So until your dog doesn't come in contact with a rabid animal, he can't get rabies. A rabid mother can't whelp the babies or puppies. But then, so what is our prevention or vaccination protocol? The vaccination protocol is you give first vaccine by 3 months of age, a booster within 4 weeks. So that is most important. Once you give first anti-rabies vaccine to a puppy, the booster should come within 4 weeks. And then the vaccine is annual. If to be on the safer side, and when you are not aware whether the parents were vaccinated against rabies vaccine or not, you get the puppy vaccinated before 3 months of age, then he will again take one booster at 3 months and then another within 4 weeks of the second shot. When we talk about feral or mongrels or street animals, which lot of animal workers or handlers help in about birth control, feeding them, taking them to non-governmental organizations and animal shelters. And we often get them vaccinated with one rabies vaccine that is not sufficient. So if you look after a dog and take the dog to an animal shelter for a birth control program, make sure the booster of the rabies vaccine comes within 4 weeks. That is how the dog is immunized for 1 year. Those persons who are vaccinated or who work for dogs can always take a pre-exposure protocol, which is, I think, 0, 7, and 21. And then you're covered for life, and you should not worry about if a dog bites you thereafter, because you have some antibodies in your system which are already working around. But then in case of dogs, why this is so important is because being an endemic country, WHO has laid certain guidelines which you have to apply because rabies continues to be a notifiable disease in Indian subcontinent.
It's also good to know that there's so much of preventive measures available to prevent rabies in pets and as well as people who take care of them. Dr. Kashyap, the next question is to you. What precautions should one take to prevent rabies as a human beings?
So to prevent risk of rabies to human beings, it's important that one first and foremost, there's something called pre-exposure prophylaxis. Now, pre-exposure prophylaxis is for people who are at high risk of exposure, such as those who are dealing always with animals or vet doctors or people who are regularly handling bats or workers in animal quarantine or rehab centers or people who are working in labs, who handle rabies samples or even wildlife officers. So it's important for all of these to take the pre-exposure prophylaxis, vaccination schedule. And it's also important to vaccinate dogs, cats, pets, as already mentioned. And it's important to avoid playing with stray animals or wild animals and keep pets away from stray animals. And thereafter, as we discussed, post-exposure prophylaxis, if bitten, scratched, or licked by an animal, then it's important to wash the wound and use 70% alcohol or povidone iodine, and also follow the vaccination schedule, which is on day 0, 3, 7, 14, and 28. The vaccination this is the vaccination schedule for whether the dose is given intramuscular or it's given intradermal. Now, if it's intradermal, which is within the skin, then the dose to be given is just 0.1 ml. So that's a little cost effective. But at the same time, it requires specific expertise for a person or the staff to be trained to give that intradermal injection. Otherwise, all category 2 or category 3 exposure, which is nibbling or licks of uncovered skin or minor scratches or abrasions without bleeding or even broken skin, will need immediate rabies vaccine, that is anti-rabies vaccine, post-exposure prophylaxis. It's important to note whether the animal which is bitten the patient is alive beyond 10 days. If the animal is alive beyond 10 days, then one can skip the remaining doses of day 14 and day 28.
Okay. Thank you for that very informative answer. But a couple of times you mentioned about dogs licking a person. But I think, as far as I have seen, I don't have a pet at home, but then as far as I have seen in other homes, people are constantly being licked by their pets, dogs or cats, whatever may be. And also, sometimes even perhaps a minor scratch or a little a nip or something like that. And a lot of people ignore it, saying that, oh, this is okay, it's my pet dog, and he or she is fine, and I'm going to be okay, nothing is going to happen to me. So does one need to really take it seriously, or can such little licks and nips be ignored?
Sure. Sure. So a lick on intact skin, which is, not broken skin is perfectly fine. It's considered category 1 exposure, and there is no need to take a vaccination for that. But if that skin is abraded, or if that skin is exposed or is not intact, then that is considered as category 2 exposure, and that definitely needs, immediate anti-rabies vaccination. And it's also, as Dr. Vivek had put it, important to vaccinate pets.
Dr. Vivek Arora, what are the steps to follow if a pet has bitten somebody? I mean, not for the human being, but for the pet. What special care should be the pet, or special attention, or whatever it may be, should the pet be given? Or let's say if one pet is bitten by another pet, is there any steps or treatment or anything to be done for that?
See, so we are presuming here if one pet dog has bitten another pet dog and both are vaccinated. First and foremost, if in such a condition, WHO says that the short due should not be within 6 months of the bite. But having said that, the most important part is there is a degree of wound care that needs to be taken. The wound cannot get infected. Wound dressing, wound cleansing, and of course, antibiotic protocol is of course required. But the other most important part is there is a level of mental trauma that the pet goes through, because in any such scenario, there is an altercation between two pets or two animals of the same social hierarchy. So there is a mental trauma of somebody dominating the other, physical abuse or bite happening in front of the owner with whom the pet feels most secure about. And thirdly, and most importantly, that in any such scenario, the confidence that your pet can feel safe in a neutral environment. So A, there's a medical necessity to be attended to as far as the wound is concerned. And B, there is an emotional necessity which you need to address for today, for a week, or probably 4 or 5 weeks, wherein your pet can become normal or resume to be normal beyond that accident. And the most important part here is, which all pet owners and of course pet parents needs to understand, is how important is getting your pet neutered or spayed at a right age is, so that these alpha instincts don't occur, the Tomish or the dominating behaviors are controlled, and the different breed characteristics are not displayed, wherein a few dogs living in a common society or being in a common area don't try to be dominate just for the sake that they believe that they are the leader of the pack.
That's very interesting. Thank you. And I particularly liked the way you said about the physical as well as the emotional trauma that a pet can have.
Yes.
After there's an injury. I think that's very important to note. For the viewers, I think a lot of us, especially people who don't own pets, think that it's only physical trauma that an animal can have. We think that emotional trauma is probably mostly in the human beings and not necessarily in the animals. But I'm so glad you brought it up, because I think that's a very important aspect too. So thank you so much for that answer. Dr. Kashyap, the next question to you. I think you have already answered this. Within what period should a anti-rabies injection be administered? Thank you for that. But how effective is vaccine against rabies? And is there a vaccine that can offer protection for life?
The vaccine is quite effective. Existing vaccine regimens for rabies post-exposure prophylaxis. So, which means, if taken in the right schedule, in the right protocols, and given in the right manner, are close to 100% effective, which is the expected number of rabies deaths in patients after receiving the vaccination in full dose and with the right schedule and with the right protocols after a confirmed rabies exposure is fortunately very, very low. One should take the anti-rabies vaccine as soon as possible. So, because once the symptoms of rabies begin, the vaccine is no longer helpful in prevention of rabies because it's already set in. And a person cannot really get the vaccine at birth or childhood, for lifelong immunity. Of course, a pre-exposure prophylaxis is good and is necessary for people who are at high risk. And the typical dosage schedule for a pre-exposure prophylaxis, which is, to gain immunity before having the bite for people who are at high risk, is on day 0 and day 7, day 0 being the first day of vaccination. And typically this is a 1 ml dose of anti-rabies vaccine given by the intramuscular route on the deltoid muscle. And for kids, that is children, it's best given on the anterolateral aspect of the thigh.
Dr. Arora, stray dogs are seen everywhere in India, as you know, and you said particularly in places in where people and the pets live in close quarters, then there's much more danger of dog bites and stuff. But stray dogs are seen everywhere, even on the streets, and it is a big problem, not just in big cities, almost everywhere. And they can cause harm to passers-by by biting them. What steps do you think should be done or taken to reduce the stray dog menace?
I can be called partial by saying that the word menace probably is not the right word there. But having said that, we need to understand the psychology of a species here to understand why this is happening. And when we talk about rabies, and like Dr. Kashyap said that anti-rabies vaccination is not a prophylactic vaccination schedule for children like other diseases. But then we must realize that like with COVID, vaccination is the answer when you try to prevent anything spreading further. But then awareness is the second solution here. And like all cues to conflict management, it's about stressing upon the problem, not the person. So we are stressing about rabies. We're not stressing about dogs or cats or bats or for whatever animal we're talking about here. If you live in a society where you are throwing food items on road, children and vehicles children are not playing on the park, they're playing on the road. People are driving in high speeds, they cycle, motorbikes, cars, without even bothering of any living being also being on the road. You constantly trying to cover up any possible habitat which could be available for any other in the ecosystem. And then you think that life should not object, is probably calling or asking for more than what a human being is warranted for. It's like you go in the jungle and I make a house in the jungle. I expect wild animals not to come to me and not to attack me. Right to life and right to equality probably belongs to them as well. So this is all about not only prevention, but understanding as well as to how you treat a particular species. You may give a more respect to a species like elephant because it continues to be more strong and the repercussions can be far too many to address, but probably not to dog because the human assault can be far more life-threatening, or the dog comes across as to far more vulnerable than to any other species. But please understand that you need to start to be compassionate, give respect, and have a level of sensitization that you cannot live like this. You cannot throw food items randomly on road and expect dogs not to come and eat, and while eating don't feel threatened if a human being passes by, or not object to if your dog is not neutered, does not come across as another alpha walking through a territory which is manned by other dogs as well, and they not reacting to his presence. Thirdly and foremost, if a bike running across runs over another dog, leaves a fear psychosis, thereby the pack attacking some other bike coming out in much speed, and then thinking that these things should not happen, and you keeping a pet, not realizing how a dog should be walked, how a dog should be roamed around in a public space, what kind of leash length you should be keeping at. Socialization of your dog to animals and to other animals is also important. in India, particularly in our cities, I've seen people walk dogs in a long leash much ahead of them, that too on a road. That's not how dogs should be walked. Societies, RWAs and municipal societies should realize that like parks are important for children, open spaces are important for dogs as well. And like a lifestyle issue, a socialization issue and lifestyle issue, or their right to have an open area should also be recognized now. And we should work around developing that right to life for them as well. That is how you would see these conflicts going down.
Thank you so much for telling the viewers about how to prevent or how to take care of dogs and how important it is not just for human beings but also for the entire ecosystem to prevail together and in harmony. And I think harmonious living will always improve everybody's health and safety. So thank you for that great answer. And okay, before we sign off for Dr. Arora, is there anything else that you would like to tell our viewers? Any other information that I might have missed out asking?
No, I think we have covered specifically more important, pertinent things. If there's anything else that someone wants to know, ask, or you have something else in your mind, we can of course answer that.
Sure. Okay. Thank you so much, Dr. Arora. It was really nice for you to join us and give us those enlightening answers. Dr. Kashyap, is there anything else that you would like to add, or to inform the viewers about rabies and human beings, whether it's prevention or care or whatever it may be?
Sure. So it's important, the quality parameters and the efficacy of the vaccines, it's important to maintain them. That the anti-rabies vaccine should be stored between 2 and 8 degrees Celsius, which is a normal cold chain. That is the refrigerator. And in case if it is reconstituted, then again, it can be stored at 2 to 8 degrees Celsius for about 6 to 8 hours after reconstitution. But after that, if it's unutilized, then it has to be discarded. And then, of course, periodic quality checks and quality inspection is very, very important of the vaccine, which is done routinely by the Central Drugs Laboratory located in Kasauli. So, because there are 8 different types of anti-rabies vaccines and 3 different types of rabies immunoglobulin, which is the anti-rabies serum available in India. So quality control is very, very important. And then, of course, it's important to follow protocols. So whether it's the intramuscular route or the intradermal route, and whether it's pre-exposure prophylaxis or post-exposure prophylaxis, or if the person is immunocompromised, then the anti-rabies serum has to be used. And then in case of re-exposure, of course, after a full course of vaccination, irrespective of the time since the previous vaccination or the category of the extent or exposure of the bite, if a person gets re-exposed to the vaccine, then 2 booster doses of anti-rabies vaccine on day 0 and day 3 would be sufficient, which means if a person is already fully vaccinated, that is, he's completed the full course, and if there is further exposure, then 2 booster doses are required on day 0 and day 3. So I think that should suffice. I think we've covered most of the other areas on rabies.
Wonderful. Thank you so much for your expert inputs, Dr. Kashyap Dakshini. And thank you both very much for enlightening the audience about rabies prevention, cure, care of pets and all of that. It was really nice to have you with us.